Welcome back to Pain Explain. In our first episode, we covered what a lumbar epidural steroid injection is and who it's for. Today, we're diving into the science, how these injections actually work. If you've ever wondered what's going on inside your spine when pain strikes, or how a simple injection can make such a difference, this video is for you. Section 1, a quick anatomy refresher. To understand how lumbar epidural steroid injections work, we need to zoom in on the anatomy. Your lumbar spine consists of 5 vertebrae, L1 to L5, stacked on top of one another. Between each vertebra are intervertebral discs that cushion movement. Emerging from the spinal cord are nerve roots, which exit the spine through small openings called foramina. These nerve roots carry signals to your legs, hips, and lower back. Now, surrounding the spinal cord and these nerve roots is a space called the epidural space. It's like a padded hallway filled with fat and small blood vessels. This is where we deliver the steroid medication. Section 2, what causes the pain? Now that you understand the anatomy, let's talk about the pain itself. Most people receiving a lumbar epidural steroid injection have pain caused by nerve root irritation or compression. Think about conditions like a herniated disc or spinal stenosis. When a disc bulges or when bone overgrowth narrows the canal, the nearby nerve root gets compressed. But the pain isn't just from pressure. That pressure triggers an inflammatory response. The body releases chemical mediators like cytokines, prostaglandins, and substance P. These substances irritate the nerve, make it more sensitive, and cause swelling. That inflammation spreads, and suddenly you have radiating pain down the leg, which we call radiculopathy or sciatica. Section 3, how the steroid works. So where do steroids come in? A corticosteroid, when injected into the epidural space, reduces inflammation through several mechanisms. It blocks phospholipase A2, an enzyme needed to start the inflammatory cascade. It decreases cytokine release, the same molecules that inflame the nerve. It also stabilizes nerve cell membranes, reducing nerve excitability. The result? Less swelling, less chemical irritation, and less pain signal transmission. The local anesthetic included in the injection provides immediate relief by numbing the area, while the steroid takes a few days to kick in. Analogy: think of the irritated nerve root like a microphone with too much feedback. The steroid turns down the volume, giving the system a chance to reset. Section 4, why the epidural space? But why inject the medication into the epidural space specifically? It's because this space is directly adjacent to the inflamed nerve roots. By placing the steroid close to the problem area, you get localized relief with fewer systemic side effects than oral steroids. There are 3 main approaches to delivering a steroid into the epidural space. Each method has its own advantages depending on the location of the pain, patient anatomy, and clinical goals. Interlaminar approach. This is the traditional midline method. The needle is inserted between 2 vertebrae from the back, and the medication spreads over a broader area in the epidural space. It's useful when pain affects multiple levels or both sides of the back. Transforaminal approach. This technique is more targeted. The needle is inserted at an angle toward the foramen, the opening where a specific nerve root exits the spine. The steroid is placed right next to that nerve. It's especially helpful for unilateral radicular pain. Caudal approach. The needle enters through the sacral hiatus near the tailbone. This route is often used when previous surgeries or spinal conditions make other approaches more difficult. It can also be helpful when broad epidural coverage is needed. Each technique is selected based on your specific diagnosis, imaging results, and your provider's clinical experience. Section 5, the timeline of relief. After the injection, most patients feel immediate relief from the local anesthetic, kind of like when your dentist numbs your mouth. But that wears off within a day. The steroid's effects usually begin within 2 to 7 days, depending on your body's response. Relief might last anywhere from a few weeks to a few months. That window is often used to restart physical therapy or reintroduce gentle activity. Key point: lumbar epidural steroid injections are not a cure, but a strategic tool to reduce inflammation and pain, making movement and recovery more possible. Let's review. Lumbar epidural steroid injections work by targeting inflammation right where it starts, at the nerve root. By reducing swelling and calming chemical irritation, they can offer significant, though temporary, relief for certain kinds of back and leg pain. If you're someone dealing with sciatica, a herniated disc, or spinal stenosis, and conservative care hasn't helped, this procedure might be worth considering, especially as part of a broader plan. In our next video, we'll take a step-by-step walk through the actual procedure, what to expect before, during, and after lumbar epidural steroid injections, so you can walk in informed and walk out confident. Thanks for watching Pain Explain. Until next time, stay informed, stay hopeful, and take control of your pain.